Hello, good morning. My name is Joseph Manacop, and I am here to show you and perform on how to properly open up a sterile package, um, properly prepare a sterile field, transfer and open sterile materials onto the sterile field, as well as transferring liquid solutions, sterile liquid solutions to the sterile field. And last but not the least is how to put on or don sterile gloves. The very first thing we need to do is check the doctor's orders, make sure there are orders for this certain patient that needs to have the procedure done. After checking doctor's orders, we gather up all our materials and proceed to the patient's room. We do our hand hygiene as we come to the patient's room, and then we introduce ourselves. Hi, my name is Joe. I'm your nurse today, and there is a doctor's orders for you to have this procedure done. After introducing ourselves, we do 2 patient identifiers. Ask the patient's name and date of birth. After confirming that, if need be, let's go ahead and explain the procedure to the patient and what exactly is going to happen. Ask the patient if they have any allergies, just in case they have latex allergies. Sometimes we use latex gloves and anything that would get the patient allergic to. And then we're going to make sure, give patients some privacy. Either we close the door to the patient's room, close the curtains, get the patient comfortable, raise up the bed so we won't be working down on the field or down on the patient. Do things like, if we need to lower the patient's bed down for the procedure, make sure we put pillows underneath their knees so they won't, their backs won't hurt. Pre-medicate the patient half hour prior to the procedure if need be, if the procedure is going to cause the patient any pain. Make sure we toilet them prior to starting the procedure, just so there won't be any interruptions during the procedure. And then we get our equipment, make sure we do hand hygiene again. There shouldn't be a problem doing too much hand hygiene. Okay, so here's our sterile package. Normally there's a plastic in it. Make sure that the plastic or the package is intact. Check for expiration date. Make sure there's no holes or tears in the package. Make sure there's no moisture in it. After that, you can take out the plastic bag. We look for a flat, clean and dry surface that's close to the patient, so it'll be a little bit more comfortable transitioning from the patient into your field. Next, we're going to open it up. So you open up away from you first and try to grab at least the leastmost part of it, just on the outside. We do the sides. And now we're going to grab towards. And there you go. We now have opened a sterile package. Now we're going to establish sterile field. We got to make sure, again, that we have a clean and flat surface. Make sure it's dry. And we're going to grab the drape from the sterile field and make sure you just grab the edge and let the package open. I don't know if you can see it. It needs to be above the waist level if you open it up. Let it open naturally and lay the package down. Now we have opened or established a sterile field. Now we're going to transfer some sterile materials onto the sterile field. I have a 3 ml 22 gauge syringe and needle in here. It's already open, but we're going to pretend. So try to open up the lid, make sure you don't touch the inside, make sure you don't go over your field. There you go. Oh, and before you do that, before you transfer anything to your sterile field, make sure the package is intact. Make sure whatever it is, if it has an expiration date, make sure it's not expired, intact, no holes or tears, no moisture in it. We transfer that on the sterile field. So we transferred sterile equipment into the sterile field without contamination. Next thing we're going to do is transfer sterile liquid into the sterile field. I'm going to pretend that this is like a saline bottle. It's just regular water. So we're going to check and make sure we have the right solution that we're going to put in the sterile field. Make sure that it's not expired. Make sure there's no floaties in there. Make sure it's intact. There's the the label is actually around, so and that, or actually we have to make sure before we open it up we write our initials there and the time and the date when we're going to open it. We're going to palm the label. Let's say this is the label. You're going to palm it. We're going to open it up and make sure the cap is placed on a flat surface without touching the inside. We're going to pour a little bit of it in the trash. And now we're going to pour it in our sterile field. Try as much as you can not to go over the sterile field and make sure it doesn't splash over. And here we go. Okay. You can grab the cap, make sure you don't touch the inside since it's sterile. And slowly recap it. And set that aside. Now we've transferred sterile solution into the sterile field without contamination. Alright, next thing we're going to do, I'm going to put the sterile field aside. Should be doing that. Now since we've established our sterile field, we are going to don sterile gloves. Like everything else that's sterile that you're going to open, make sure the package is intact. No tears or holes, no moisture in it. Make sure it's not expired. Do hand hygiene. And normally there's like a plastic package inside, so make sure you take that out. This is technically still clean. Okay. I'm going to open up the glove with the cuff end facing you. Oh, actually, it's in the other. Is it on the other side? That's right. Okay. You reach under and open it up slowly. Reach on the other side as well. Okay. Make sure you have the right size gloves for your hands. I normally wear a large or an extra large on mine. Next thing you're going to do is grab the inside part with your non-dominant hand, inside part and the tip of the cuff. I'm going to move away so you can see it. I'm going to slowly place. This is a small one. It tore. Okay, that's what we're going to do. These are large gloves. Alright, let's pretend that was still sterile. Again, take a pinch on the cuff, insert your dominant hand without touching the outside. It's probably going to tear. And then with this one, you insert it right there. And with your non-dominant hand, place your hand once you have both of them in there, since they're all sterile, you can readjust things like that thumb. You can pull it like that, just making sure you don't touch anything. Keep your hands waist level and away from anything that might contaminate it. Alright, that's how to don sterile gloves. One thing is too, if you are allergic to latex, make sure you don't pick up latex gloves. Anyways, that's about it for this one, and thank you for watching, I guess.